but the inside is mung bean as well. Okay. And I don't know what this. If I'm not mistaken, this is sticky rice. Oh. Yeah. Yeah. Indonesian food. Yeah. Yeah. Thank you. Of course, my favorite is nasi goreng.
Hey, Assalamualaikum warahmatullahi wabarakatuh. Okay, are you happy today? Happy. Okay, I always say, are you happy today in all my classes with my students because I want to make sure that you are happy and you are ready to listen Prof. Piru here. Okay, we have Prof. Piru from Leeds University. Assalamualaikum warahmatullahi wabarakatuh. Wait, maybe it's a mirror. Today? Mirror sound from Zoom, right? Okay. Okay, Alhamdulillahirrahmanirrahim. Praise is addressed to Allah Subhanahu wa Ta'ala. And salawat and salam is for our Prophet Muhammad to bring lights from the darkness. Well, ladies and gentlemen, if I say ladies and gentlemen, then it's going to be too formal, Prof, because they are students, they are still very young, and I think it's going to be better to greet them with a closer greeting. Okay, well, dear friends, and also Bapak Ibu, welcome to the Studium General Building Interprofessional Collaboration for Comprehensive Management of Metabolic Syndrome. And now we have Prof. Piru TV Sukumar from Faculty of Medicine and Health, University of Leeds. So, teman-teman, do you know where University of Leeds is? No? Seriously? Coba wong desa pakai mas. Okay. Yeah, University of Leeds is the part of United Kingdom universities. Okay, do you know United Kingdom? Yeah, if you don't know, then you are kebangetan ya. Okay, so the northern of UK. Yeah, Leeds is the northern of UK. Well, ladies and gentlemen, I am Setia Putri, Miss Setia. I will be the MC, the moderator, and also the translator for today's agenda. Okay. Well, I'd like to greet the dean of Faculty of Health Sciences, Ibu Dr. Dewi Rohanawati, and also the board of the dean. We have Bu Hotim and then Bu Anjar and also Pak Wanto and also Dean of Medicine Faculty, Dr. Joko, welcome, and also Bapak Ibu dosen semuanya and dear friends. Well, ladies and gentlemen, this Stadium General is held in collaboration with Universitas Aisyah Yogyakarta and University of Leeds, United Kingdom. Please give a big applause for this collaboration. Okay. Well, everyone, please allow me to read the agenda for today. First is the opening, and then second is Al-Quran recitation. Third, singing Indonesian anthem, Indonesia Raya, and Mars Unisa. And then welcoming speech from Dean of Faculty of Health Sciences, and also we are going to be in our Stadium General today. Okay, everyone, let's open our Stadium General today by reciting Basmalah together. Bismillahirrahmanirrahim. Well, thank you very much. And then the next agenda is Al-Quran recitation, and it will be recited by Rudi Setiawan. Mas Rudi, please, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. يا أيها الذين آمنوا إذا قيل لكم تفسحوا في المجالس فافسحوا يفسح الله لكم وإذا قيل انشزوا فانشزوا يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير. يا أيها الذين آمنوا إذا ناجيتم الرسول فقدموا بين يدي نجواكم صدقة ذلك خير لكم وأطهر فإن لم تجدوا فإن الله غفور رحيم. أأشفقتم أن تقدموا بين يدي نجواكم صدقات فإذ لم تفعلوا وتاب الله عليكم فأقيموا الصلاة وآتوا الزكاة وأطيعوا الله ورسوله والله خبير بما تعملون. ألم تر إلى الذين تولوا قوما غضب الله عليهم ما هم منكم ولا منهم ويحلفون على الكذب وهم يعلمون. أعد الله لهم عذابا شديدا إنهم ساء ما كانوا يعملون. اتخذوا أيمانهم جنة فصدوا عن سبيل الله فلهم عذاب مهين. لن تغني عنهم أموالهم ولا أولادهم من الله شيئا أولئك أصحاب النار هم فيها خالدون. صدق الله العظيم. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Mas Rudy, for Quran recitation. Based on what Mas Rudy has already recited, so Prof. Piru, there is a verse that mentioned, we have to look for knowledge everywhere, and this kind of class can give us, it's kind of blessed from Allah, our God. Okay. Well, the next agenda is singing Indonesian anthem, Indonesia Raya, and Mars Unesa. Ladies and gentlemen, please stand up.
Wahai seluruh mata Indonesia Yogyakarta, bulatkan semangat hatimu. Siapkan generasi untuk rakyat prestasi berjiwa profesional. Iwan ilmu kuatkan, aman mulia kerjakan, lalu ini mampu cekal. Sensor panjang pencerahan kehidupan sejahtera bagi bersama. Mengembangkan sumber daya manusia berkemajuan seperti kita. Itulah misi kita bersama sebagai simpan sumber. Bisa kita kembali cinta sempurna, sentosa memberikan jaya. Tidak tempat selalu beriman, anugerah limpahkan semuanya. Tidak tempat selalu beriman, anugerah limpahkan semuanya.
Well, ladies and gentlemen, dear friends, and our next agenda is a welcoming speech by the Dean of Faculty of Health Sciences, Dr. Dewi Rohanawati. The floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ya, alhamdulillahirabbil alamin. Allahumma sholli ala Muhammad wa ala ali Muhammad. Rabbi shrahli sadri wa yassirli amri wahlul 'uqdatam min lisani yafqahu qawli. Amma ba'du. Good afternoon and warm greeting to all. Distinct Rector of Universitas Aisyah Yogyakarta, our Honorable Guest Prof. Biru TV Sukumar, Vice Dean of the Faculty of Medicine, University of Leeds, Zuke, Vice Rector and University Leadership, respected faculty member, dear student of the Faculty of Health Science. Ladies and gentlemen, it is a real pleasure for me on behalf of the Faculty of Health Science to welcome you all to this special occasion. We are honored to host today Studium General, the title Building International Collaboration for Comprehensive Management of Metabolic Syndrome. And even more honored to welcome Prof. Biru TV Sukumar from the University of Leeds. Prof. Biru, thank you for being here with us. This visit represents a significant moment for us as it opens new opportunities for academic collaboration, exchange of ideas, and the strengthening of global partnership. The University of Leeds, as one of the leading institutions in UK, has long been recognized for its academic contribution, particularly in the field of medicine and health science. We are inspired by your achievement, and we hope this visit will mark the beginning of fruitful cooperation in research, education, and professional development. We believe that your insight and experience will greatly enrich our perspective, especially for our students who are preparing to take on a real challenge in the field of health. To our students, I hope you take this opportunity to listen carefully, to ask questions, and to be inspired. Encounter like this can be turning point in your academic journey. I would also like to thank the rector and the university leadership for their support in facilitating this event, and all faculty members and students for your enthusiasm and participation. Once again, welcome to University Aisyah Yogyakarta, Prof. Biru. We look forward today and the possibility and may be open for our institution. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Bu Dewi. Well, ladies and gentlemen, dear friends, we are now in our main agenda, which is a Studium General. Well, Prof. Biru, I want to show you why they are wearing different uniforms. So the topic of today's Studium General is intercollaboration, right? So we have different students from different programs. For those who are wearing gray veil, they are from nutrition program, right? So these ladies, they are from nutrition program. Where are the other nutrition students? Okay. And then for those who are wearing green uniform, they are from anesthesia program. Okay. Wave your hands, please. Okay. And then those who are wearing blue veil, they are from physiotherapy. Okay. Physiotherapy, where are you? Okay. And then next, the blue ones are from radiology. Radiology. And then ladies with the yellow veil, they are from midwifery. Midwifery, where are you? Okay. And then those who are wearing cream veil, they are from medical laboratory technology. Okay. So, dear friends, teman-teman, so ada yang belum disebutkan? Oh, nursing. Where are you? Okay, so those who are wearing green uniform, they are from nursing. Okay, so in bahasa Indonesia, we know tidak kenal, tidak sayang. If we don't know, then we don't love each other. So that's why I'm going to read the, yes? Oh, okay. So we have also medical students. Where are medical students? Ah, okay. Yeah. So, thank you so much for being here. So, biar kita kenal, so I'm going to read Prof. Piru's CV. So, we have Professor Piru TV Sukumar, and then he graduated from Bachelor of Medicine, Bachelor of Surgery. So, are you a surgeon? No. Okay. Yeah. And then he took his master degree in medical science in technology. And then he got Doctor of Philosophy in Biomedical Science. Oke. Ada yang mau jadi apa namanya? Biomedis? Yes? Yeah, yes, yes. Yes, yes aja. Okay. And then he has already got great experiences. So his current position is a professor of global engagement and education. Wow. Okay, congratulations. You got this professorship last year. Yeah, congratulations. And then his areas of expertise, global educational partnership, internationalization, globalization of medical and health education, ion channels, insulin resistance, ROS signaling, obesity, and metabolic syndrome. Pusing nggak teman-teman? Ya Allah. Amazing. So from education, insulin, and then internationalization, obesity, otak kita nggak nyampe ya teman-teman. Oke, nyampe kalau mau ya. Oke, and then he has been in Leeds University since 2016 until now. And then, yeah, as I told you previously, he is a professor of global engagement and education. Okay, without any further ado, we have Professor Pirutivi as our speaker today. The time is yours. Sure. You can walk around. Good afternoon. Teman-teman, don't forget to ask questions later on. This is your chance to get to know closer what is in Leeds University. Maybe later, if you have chance to continue your study, maybe you can choose University of Leeds as one of your destination. And this is also your chance to know better about, yeah, knowledge in your maybe related to your program, related to medicine and everything. Okay, so please you can pay attention and ask questions to Prof. Piru while he is here with us.
Thank you. Thank you very much. Oh, can change that. Oh, that's good. Thank you. It's a great honor and pleasure to talk to you all. The best part, like ma'am has read my specialization or areas of expertise, like more than anything else, the most enjoyable part of my job is talking to students. As you all know, any teacher can vouch for that. We all have these faculty meetings, teacher meetings, all those issues. Those are not enjoyable parts. The enjoyable part is talking to students. You guys are the one why we come to work. Yeah. So these 2 days I'll be spending in UNISA and meeting with a lot of you and looking forward to a lot of interactions with you. And I will start with introducing Leeds. Ma'am has introduced me, but Leeds, if you don't know Leeds, you might have known Manchester, Man United. Yeah. Yeah, Liverpool, Man United. Okay. We are about 1 hour by train from Manchester. We also have Leeds United, but this year we have qualified for Premier League. So next year, next year you will see Leeds United playing with Manchester United. We are all dreading that, but it will happen. So we are almost in the bang in the middle of UK. It's north of England. Probably you know UK made up of 4 different countries: England, Scotland, Northern Ireland, and Wales. England is the by far the biggest. Like we are in the north of England. I was telling some of your teachers that you can compare Leeds and London like Jakarta and Yogyakarta. It's always nice, peaceful, lovely weather, nice people, nice food, less traffic, less pollution. You love Yogyakarta rather than living in Jakarta, right? Same for us. We love Leeds. We can visit London. We cannot live in London. Same. Okay, so in Leeds, we like in UNISA, we have faculties. We have 7 faculties from science, technology, business, everything. I come from medicine and health faculty, which has medicine, dentistry, nursing, midwifery, and also psychology. We also have biological sciences, which has the biotechnology related programs. Apart from that, we have engineering, business, social sciences, humanities, everything. So the topic given to me today is to talk to you about building interprofessional relationships for better working environment for you when you move on to your work life. Not most of you, all of you are doing a program, professional program, which will lead you to be a professional. Professional means you are going to use the knowledge you have gained during your studies, directly apply them in your job. There are very few people who can call that they are directly applying what they study into their jobs. So you are fortunate and lucky to be in that group. But the thing is, the working environment you are going to go in is not about single professional or profession. It will be a multitude of professionals coming together to deliver a single goal. All of your goal is to help the patient so that his or her health is improved. Yeah, you're going to see patients. Patients are nothing but like us or us, among us, human beings who are having issues with their body or mind. We all have this unique aim of or single aim of helping the patient to improve their health. So, not a single profession can address all the needs of the patient, let alone patient who is having multiple diseases. Even single disease patient cannot be helped by single professional. You need starting from who are looking after medic, obviously, prescribing anything. Somebody has to do the investigations, radiology people, medical laboratory technical people. Somebody has to administer the treatment, nursing staff, physiotherapy people. Yeah. So multiple professions have to join together to work to improve the patient. So as far as interprofessional collaborative practice is concerned, WHO defined in early 2000s it as when multiple healthcare workers from different professional backgrounds work together with patients, families, carers, and communities to deliver the highest quality of care. So you should always aim to deliver the highest quality of care for the betterment of patient, their carer, their family, ultimately the community. So no other disease is, you can say, suit as the best example to demonstrate the importance of interprofessional working than metabolic syndrome. Yeah, metabolic syndrome itself is a multidisciplinary disease which is unfortunately becoming increasingly common around the world. So we can take that as an example where multi-professional workforce development is important to deliver the high quality of care. Just to recap ourselves, what is metabolic syndrome? It is nothing but group of diseases which all are thought to originate from a group of risk factors and also some other causative agents like from unhealthy eating to lack of exercise to stress. We all are stressed, aren't we? It's very fashionable to say like I'm stressed. Yeah, I don't know about UNISA students. I believe they are better. Like whenever we announce exam in our university, suddenly the attendance into our student counseling centers go up. People take exam as a stress. Yeah, we never thought like that during our university days, did we? Yeah, it's a difficult one, but as you are in higher education, you are going to be interested with the responsibility of somebody's life. Yeah, see, that is the biggest responsibility any person can have. So you should prepare yourself to meet that responsibility. So that is the ultimate thing. All these exams, learning, everything is just step towards that. So don't take your exams as a stress. It's just part of your life, part of the profession you are choosing, you are training for. Ultimately, this will all help you to achieve what your goal is, that is to help the patient. So I refuse to accept that exam is a stress. It is a difficult period. You have to prepare for that, work hard for that, but don't take it as a stress. Yeah. Okay, so all these things, especially with this modern lifestyle, sedentary lifestyle, this metabolic syndrome is increasing. As I told, it is diseases of multiple things, starting from hypertension, glucose intolerance, or insulin resistance, leading to diabetes, which is associated with multiple other things, including cancer and psychological illnesses. Put together, the patient you will typically see, again, it is more common in Western world. In this part of the world, I come from India. It has very similar demographic to Indonesia. So in our part, it may not be as severe as Western world, but we just follow a few years late the Western world. So we will if we are not careful, we will also end up there. So obesity associated with lipid problem, heart diseases, hypertension, diabetes, mental illness, PCOD in women, infertility, all these things joined together is called metabolic syndrome, or other word is syndrome X. So as the name suggests, like it's a syndrome, not a single disease. So you need multiple people to take care of it. It's a growing global health concern. It is not going to go down. We are changing our way of life. So it is going to become increasingly common to have people with metabolic syndrome. I know we have medics here. I also was trained as medic. We have a lot of other healthcare professionals there. A lot of people still, especially in our part of the world, in the developing world, still think medical treatment or treatment is the responsibility of a medic, of a doctor. Yeah, they have the ultimate responsibility. All other professions work around the doctor. That's the notion we have. That's in practice as well in a lot of places. But things are changing, especially Western world already has changed, but we will follow them because that model is good. We are following them in bad stuff. Better we follow them in good stuff. I can definitely tell this if students coming from developing world like Indonesia, India, Thailand, and all, if they ask like, what is unique about Leeds or UK education? What should I learn from that? Okay, you are coming to do some program. You can learn that, acquire the knowledge, skills, and all is important. But please learn the other stuff, life stuff as well, like punctuality. Yeah, punctuality is in Western world is it's taken very highly, like valued highly. Being truthful, being honest, humility, punctuality, and following the rules and and having a goal and career path, these kind of soft skills, teamwork, networking, these kind of things, like in our culture we don't open up that much. Yeah, we try to keep it ourselves, have a small group of friends, not go out and interact with people outside our comfort zone. Those things change in the Western world, and they utilize it for the betterment of their career and life. So if any of you is going to Europe or US or even Australia, if you look at the society, it's like people are willing to open up more and learn more from others. So those things you can definitely learn as well. So this metabolic syndrome is increasing, and we cannot put all the burden of treating that on in the hands of medics, in the hands of doctors. It has an economic angle as well. As you know, medical program is 6-7 years, and then specialization another 5-6 years. 10-15 years you will need to develop a full-blown specialist. If we are using 12 years trained cardiologist to take an ECG, it's a waste of their training. Yeah. In for example, in Leeds, we have a bachelor's in cardiovascular technology who can take ECG and interpret the ECG. We have an echocardiography program, BSc in radiography, ultrasound, who can take simple X-rays, ultrasound, for example, ultrasound abdomen or echocardiography, and interpret the cases. It's not just taking technician and also interpret as well. So what it does is it frees up the time of highly trained specialist medic to look after the complex cases and delve deeper into the patient care. So this is the simple example of how we can like utilize multiple professionals to their advantage, to the advantage of the state, advantage of the government and the hospital, so that the patient care is delivered. Another thing is aging. As you all know, our societies are aging rapidly. If you see 15 years ago, the average age must be in early 30s or something. Now it is nearing 40. So we are getting more elderly people, More elderly people means more diseases. More diseases means multiple diseases joined together. Not you, if you go to any clinic, you won't see a patient with single disease. Usually they will have multiple disease. The patient will have hypertension and diabetes with metabolic syndrome, or they may have a cancer and heart failure, or they may have rheumatoid arthritis with some kidney disease. So multiple disease patients are increasing and elderly population is increasing. This all makes it absolutely essential for multiple professions join together to work to deliver the care. Yeah. So why interprofessional collaboration? As I told, metabolic syndrome is a multifactorial disease. No single discipline can manage it alone. Collaboration leads to holistic care. As you know, now people are more worried about quality of life rather than quantum of life. Yeah, you understand the difference. If you ask anyone whether they want to live 100 years, but they will have all the cancer, headache, they will be weak, they will be bedridden. If they want to live a life like that for 100 years or very healthy life for 70 years, most of the people will choose healthy life for lesser duration. Yeah, people are looking at quality of life. That's where professions like physiotherapy come into place. Yeah, if you look at 15, 20 years ago, physiotherapy profession importance was not known. Now it is highly known, but even people in palliative care or in very terminal diseases like CA lung, for example, cancer lung, they always go for physiotherapy so that they can keep moving, they can be independent until the time of death comes. Nobody wants to be bedridden, nobody wants to be tied to the chair or a bed until the death. Even if they want to, if they live lesser, they want to live a healthy, mobile life. So that's where other professions will come into place. That's what holistic care is called. This idea of holistic care is very new, 10, 20 years. Before that, the only aim was to prolong the life. If you prevent the death, that's fine. Healthcare professions job is done. As long as pain-free, reasonable, prolonged life, that's fine. But now it is not like that. The person want to be independent, move around, do stuff normally. So you need to look at their physical health, their mental health, their mobility, their social care, their living place, hygiene. You have to look at all those stuff. Their nutrition, obviously. People want to live and eat healthy, at the same time eat tasty. What's the point of living a life? Like I remember telling to one of my old aunties, she was in 70s, 75 or something. She loves pickles. Yeah, you know, pickles are very high in salt. She's a very severe hypertensive and heart failure patient. So I told my aunt, like, can you cut down pickle? Yeah, she was 75 or 76. Please cut down. Not can you. Please cut down your pickle. It is not good for your health. Her answer was, Piru, living life without pickle is nothing for me. I can live for 2 years, eat pickle, happily die. I don't want to live 15 years, not eat pickle. Truth. She told. So the people priority has changed. They want to live healthy, happy life, even if it is shorter. So holistic care idea is born out of that thought. You have to give the holistic care so that you give better outcomes for the patient. Another point is adherence. As medics, doctors can advise a lot of things. Yeah, don't eat that, don't eat this, exercise, don't be feel stressed, relaxed, take all this medicine. But once the patient is out of doctor's clinic, how many of the patients follow all this advice? 50%? Even lesser than that. That's where the clinical psychologists come, the nutritionists come. You guys can talk to them about each and everything's benefits. What will be the outcome if they adhere to that, not adhere to that, how they can tweak it so that they can live a life, happy life, at the same time make it a healthy one. If they hate walking, no point in telling them to do walking or exercise daily 30 minutes or 40 minutes. You have to find alternative. Do some different as a kind of exercises, some different dances, for example. They may be interested in dances. Dancing is a best exercise. So that thing, the allied health professionals, so-called paramedical allied health professionals, can give that holistic care so that adherence to medical advice is better, the outcomes will be better. And also this fragmentation and duplication. As you know, like if people who have been to intensive care unit, yeah, you know ICU or intensive care unit, isn't it? Like people who are very sick, they are admitted to intensive care unit. Usually they are under the treatment of 3 or 4 different specialists. So the person may have kidney problems, so nephrologist will be there. He may have a heart problem, then cardiologist will be there. So cardiologist will write 5 medicines. Then the nephrologist will come. Oh, this one is bad for kidney. This one is bad for kidney. Reduce that, cut that, cut that. Then the neurologist will come, add some more vitamins. Cardiologist will come. No, no, don't give that calcium or anything. So it's a look at it. It is single profession of medicine. Within that specialist, they can't agree on one another. Yeah, it is the duty of whoever in charge of intensive care unit to decide on the final outcome. That group should contain the experienced nursing professional, experienced pharmacist, and an intensive care specialist as well. So all these professions have to work together to deliver the better outcome. We have a lot of professions. Somebody told me in UK there are 142 allied health professionals. Specific programs, bachelor programs are available for different, from ambulance technicians, ECG technician, or audiologist, for example, optometrist, anesthesia technician, or blood transfusion technician. There are 140 odd professions are there. So this group has to work hand in hand to deliver the patient care. So if you take metabolic syndrome, I have just listed out few of the professionals who will be involved. Obviously, primary care physicians or family medicine, family physician. Then the specialists like endocrinologist, cardiologist, nephrologist, even ophthalmologist, for example. Those kind of people, doctors. Then for investigation, radiological people, and also lab investigation people, then nursing staff, obviously, to deliver all the care, dietitians, nutritionists, pharmacists, physiotherapists, physical therapists, and if the person is under some kind of in occupation, the occupational therapist, then mental health professionals. We all understood the importance of mental health during COVID, isn't it? Like COVID is a big eye opener for us. Like, for example, I always thought I am an introvert. I can just manage my own. It doesn't matter. I don't need people to talk to. But 2 months of lockdown, that's it. Then I want to see people. I want to talk to people. Mental health is extremely important to do anything, let alone a job, to live. Mental health is important, mental health professionals. Then all these combined together, community health workers. But we are forgetting another group of people who deliver it from the top, from the government, ministries, health planners, policy makers, yeah, public health people. Those people between these professionals are concerned, what are all the core components? So these are all taken from literature only and also from our curriculum where we deliver it during our first years in all the healthcare professionals. So you need to develop this idea of shared decision making. First, as I told, like in general, we entrust all that responsibility of decision to the medics. But things are changing. Nowadays, if you go to any UK hospital, yeah, if a cardiologist is going to prescribe a list of medicine, it is not immediately given to patient. It goes to the pharmacist. Pharmacists look at drug interactions and then decide on which to give, what is the dosage. Yeah. Similarly, a surgeon, for example, asks for a couple of CT scans or X-rays. It goes to senior radiology consultant or radiography consultant to look at how much dosage of X-ray that patient has undergone. If the patient has taken 100 X-rays in last 1 year, there is no point in putting him again under the X-ray machine. You will start inducing a lot of cancers there. So all these things have to be calculated, have to be monitored. So a radiographer comes into the picture and to decide. Similarly, ultrasound, similarly, echocardiography. Similarly, diet instructions, those kind of decisions are not anymore made 100% by doctors, but by consultation with other professionals as well. So we need to develop that practice. So you take ownership of your activity. It should never be like for example, a medical laboratory technician working in the medical laboratory. If a patient or if a doctor gives a list of tests to take, usual practice is you just do the test. Yeah. In UK, it doesn't happen like that. That medical laboratory technician also has a say in that. These things, yeah, these two was done two weeks back. Do we need to do it again? Why should we take 15 ml of blood? Rather, we can do, if we cut out these two, we can do 10 ml of blood. Yeah. So they have this shared decision-making authority that gives them ownership of what they do. Take pride in what you do. Yeah. That comes with only if you have the responsibility and ownership. That comes in the Western world, it's a bit more developed. People look at all professions within healthcare with equal respect and mutual understanding as well. So those kind of things come with shared decision making, but good communication is very important. Rather than just keeping it yourself, what's your thinking, you have to communicate. A person, for example, a medic has asked for urea creatinine, a medical laboratory technician, or better example will be glycosylated hemoglobin, HbA1c. Yeah, it gives the average glucose for last 6 weeks. Yeah, something like that. If a medic has asked for that test, but as a technician, you notice in the medical file that this was done 2 weeks back, there is no point in repeating it within next 2 weeks. It's not going to change much. So you can go back to the medic and say, see, it was done 2 weeks back. You don't need to repeat. Yeah. So those kind of communication, but you need to be careful when you communicate with other professionals. All are professionals, all are knowledgeable. So make sure your knowledge is good. Don't go with bad argument, wrong argument. It need not be an argument even. It is just mutual discussion to come up with best plan for that patient. So communication is absolutely essential. And also define roles and responsibilities. What's your role? What's my role? I gave the example of cardiovascular technologies, like who has the remit of doing ECG, exercise testing, and also echo. Yeah. But if a case, for example, is a congenital heart disease who has undergone 2 kinds of surgery, a baby, it is a very complicated case. Obviously, that echo need to be done by a very experienced echocardiographer or an experienced cardiologist. So you understand which cases, what responsibility, who has to take that role. Those things should be defined well within a team. So that's why it's called teamwork with shared responsibility and decision making. Integrated care plan, it's again that who takes care of what. I take care of pharmacist, I take care of all the medicines, dosage, interactions, make sure medical prescription is right. So you don't go and meddle with a nursing staff who is giving injection, tell them like, don't put it on the Venflan, do it in IV. That's not your job. Yeah? If you are in that profession, if you are in a team, know where your limit is. If you cross the limit, step on others' toe, obviously it will rise to unnecessary tension between the professionals, then the whole teamwork will fail. So that's important as well. Final thing is electronic health record. In this day and age, most of the things are maintained on computer. Yeah. So each profession may have a different platform to manage. Medical laboratory technician may have a different platform. You are as a physiotherapist, you may have a different platform for your prescription, but things are changing. It's all coming into a single platform. So you have to work together to share that responsibility as well. So just as a case study, let's take a patient who is obese, who has type 2 insulin resistant diabetes and also hypertension. So if the person is having what symptom he or she may have some tiredness, some giddiness, or some breathlessness, that kind of symptom. Where he will go first? He'll probably go to a general physician or a family doctor. Yeah. So primary care physicians is important. Then the primary care physician will send the patient to probably secondary or tertiary care for specialist opinion. They have to see a cardiologist, for example, endocrinologist, for example. They may need to get their eyes checked, kidneys checked, those kind of specialists. Then they need to see, obviously, when it comes to treatment, they have to do diagnostics. So obviously, your radiography, and laboratory technicians come there. Then the treatment plan will invariably include physical therapy and also diets. So both these professions will come there. Then finally, it will all depend on how the nursing care is delivered, social care is delivered, how it is implemented in the community. Community healthcare is working in that community. It's not like a person who is coming from one area having one disease, it is limited to that person. Probably in his family itself, there may be hypertension and diabetes. Maybe in their community, it may be prevalent. You have to look at that as well. It's not stopping with single patient. So to get an improved clinical outcome and also community level social outcome, all these professions have to work together. But it's all well and good. We have to work together, but it's not easy. It's not at all. Let's not pretend that it's going to be easy. No medic would like to listen to a physiotherapist. No nurse will like to listen to dietitian. Yeah, we all are proud of our professions, and we want to feel like we can do everything. Yeah, but we have to understand our limitations. Each profession has its own limitation. A medic cannot come and give a physiotherapy. A nurse cannot come and do the diet chart. Yeah. So you need to know your profession's limitation and value what other profession is bringing to the table for the betterment of patient care. So for this, communication is very, very important. It's not just communicating within the professional group, but outside the professional. If you have started doing night duty and all, you will know what is called handover, isn't it? I believe here also it's called patient handover. When you finish your night duty or your rotation, you hand over the patient to the next person who is coming. It used to happen in UK also. It used to happen profession to profession. Nursing staff will hand over to nursing staff. Medic will hand over to medic. Pharmacist will hand over to pharmacist. But now it all changed. They have aligned the shift pattern for all professions, and handover happens in team so that nothing is missed. It is in literature you can find one of the biggest sources of medical errors is missing items, missing issues due to handovers. It's not easy. You have done the night, 12 hours, very busy shift, 15 patients. Each patient is complicated. Few are waiting for some bloods, few are waiting for some scan, couple are waiting for surgery. You cannot physically remember everything and hand over everything to one on basis. If it is a group, a nurse, a pharmacist, a ward technician, and a medic together is handing over, nothing will be missed. People will remember, oh, you forgot that person has to be given blood today. Oh, this person have to be taken for X-ray today. So those kind of things can be managed better. So this communication during handover is very important. For that, you need to learn how to speak to other professionals. That's where we try to include that into our education. I will come to education later. So education is important, training is important for teamwork. Because when you do your classes, how do you do? Nutritionists attend the class separately, physiotherapists attend the class separately, lab technicians attend the class separately. Yeah? You need to fulfill all those requirements to get your professional registration. Yes. But what you can do is you can have some sessions together. In Leeds, we started implementing it. I will give some example a bit later. Then time constraints. Each of us is busy with our own work. Where is time to interact with other professionals? We have to make time for that because ultimately it will impact on the delivery of care. Role confusion, who is responsible for what? Reimbursement challenges. And another thing is economical challenges, financial challenges. If ECG technician is doing the ECG, whether ECG technician should be paid for ECG or the cardiologist be paid for ECG. Those kind of confusions. In public sector, it is different. In private sector, it is different. I was recently in India to advocate. They don't have a professional echocardiography programs for non-medical people. So I was convincing new universities to start a bachelor's in ultrasound echocardiography. The biggest issue they had was the cardiologists will hate it because that is income source for them if the echocardiographers take away that income. So those kind of things will happen. We have to face that. We have to work out the solution for that, because if you need 100 100 echoes a day, you cannot have enough cardiologists to do everything. Instead, you can better employ one echocardiographer who can take 100 in a day. So economically, it will make sense, but how it is reimbursed for each profession, we have to work that out. So we have to stop focusing on the problems, but rather than focus on the solutions, the first and most important solution is interprofessional education. The motto for our Faculty of Medicine and Health in Leeds tagline is learn together to work together. Yeah. We are going to work together. The nurses, the dentists, the medics, the cardiac professionals, audiologists, radiographers, we are going to work together. Why don't we learn together so that we better understand each other so that we can work together? So that's very, very important. So how we can learn together? Obviously, each have their own curriculum. So much to learn. Where is time to go and learn from other professionals? But we have to make that. We have to make specific sessions so that they join together. We can see some examples. We can use technology for that. Obviously, the leadership, your teachers are very progressive. I can see from the discussion this morning as well. They are open to new ideas, revolutionary thoughts. So we have to inculcate those things into the curriculum, in the syllabus, so that we enable interprofessional education, which will obviously lead to interprofessional collaboration at workplace. So as far as interprofessional education is concerned, we work on the basis of addressing 4 themes. First is defining roles and responsibilities. So we have to be sure of what's our role, what's our responsibility in the total holistic care of the patient. What is ethical and what are the conflict areas? Some professions may find something more ethical than other professions. Cardiologists may will manage. What are all the things they can bring to the table? What they know about pediatric pneumonia in their professions? What are all the things they have learned? So give them a free afternoon and a topic. Ask them to learn together, discuss together about the patient care and outcomes. So that is informal way of learning as well. And we need to definitely create the shared learning spaces. I'm talking from Leeds point of view. Like each people have their own classrooms and stuff. Yeah. Now until 2020, until COVID lockdown, we had it like that. After that, we have made it open to all professionals. So the library is obviously open for all professionals, but also teaching spaces and student discussion spaces are open for all professionals all the time. So you have to create that spaces for that those professions can interact together. And you should have the teachers, tutors, facilitators trained as well. It's not easy. If you ask a nursing tutor to go and take a class for a physiotherapist, he or she will be lost. It's not easy because we didn't learn in our generation, we didn't learn much about interprofessional education or working. We learned it on the job, actually. Now we are trying to teach it. So we have to train the teachers as well. student facilitators or our students or our teachers. I'm sure most of your teachers will agree. You guys know so much, in some cases, much more than us. You have whole wealth of knowledge in front of you, in your hand. Google and YouTube can teach you anything, yeah, which we can't even dreamt of. 20 years ago, 30 years ago, when I was in med school, I have a doubt about a muscle insertion where it is this bone or this groove or that one. I have to go to the lab. Sorry, I have to go to the library, take Gray's Anatomy, look at the page, and find it. You cannot ask ChatGPT what is the insertion of deltoid. Yeah, that's how we learned. But you guys have everything in your hand, so you are learning more. So this interprofessional education is addition to what you need to learn, what we learned. So student facilitators can play a great role in this interprofessional education. Role modeling, learning activities, and also including patients, carers, community into it will also help. How the carers, we in Leeds, we call it as triple P, PPP, patient public participation or patient carer community. Two kind of bodies are there. If we are going to implement something, even if that echo room is going to be changed from first floor to second floor, usually these PPP people are taken into consideration. They will voice their opinion. Is it good to put it there or it is better to keep it here? Yeah, they are the ultimate users. So they also need to be involved in this training. So I will complete with what Leeds does in this space. So in the first year, what we do is all our healthcare professionals do few sessions on the basics. It is nothing scientific. All of you learn anatomy, physiology, bit of biochemistry, pharmacology, all those stuff. But these joint sessions are primarily about ethics, roles, responsibility. Importantly, give respect to other professionals. Medics are the most notorious. Yeah, I'm sure here also the same story. It used to be the case. Medics thinks they are the ultimate decision makers. They are the top of the hierarchy. So that hierarchy goes from medic to down. But those things are changing. Especially we want to change during the education itself by putting medics, nursing students, midwives, physiotherapists together in a classroom and talk about their roles will help each other understand their others' roles and also give mutual respect. Yes, this person knows more than me in this area, in this particular area. So I have to give space to that person to deliver the care, what is needed for the patient. So that mutual respect is what we aim for through this first 1 or 2 years joint courses. During the mid years, we usually go for case discussion, theoretical it is. With PowerPoint, each profession, at the same case is given, each profession discusses it from their point of view. Ultimately, the facilitator will come up with the treatment plan, incorporating all the discussions from different professions. In the final year, obviously, most of the time will be spent on ward. So it's learning on job. We deliberately mix up the professions when we allocate students into particular hospital or ward so that they learn together by working together. So that's the least model. And we also include public health students into it in some of the areas, especially in the community and preventative areas. If the case discussion is about metabolic syndrome, for example, definitely we add students from public health into it. They bring their own perspective into the patient care. Need not be individual patient care, but for the community care. So this is the Leeds model. I'm sure you can develop even better model, but you can take some inspiration from it. Finally, some take-home points. Collaboration is essential for managing metabolic syndrome and most of the diseases in this increasingly aging, complex diseases world. Multidisciplinary teamwork improves health outcomes, at the same time lower the cost. Invest in team building, education, and collaboration. The infrastructure should be built around these themes so that the patient care can be better. Ultimately, remember, whatever said and done, your ultimate responsibility is towards your patient. That should be your only aim. You have to improve patient quality of life or their length of life or both. Don't be afraid to challenge the other professionals if you find some unethical practices or wrong notions or wrong treatments. I know during my like ward rotation, house officer internship time, if a consultant tells a wrong thing, the nursing staff or even the junior doctors won't open their mouth and say, no, you are wrong. But now things have changed. People are open to criticism. Mostly, there are still people who don't like criticism, but world is changing. People are more open. You can say what is wrong, what is right, irrespective of the seniority or hierarchy. By doing this interprofessional education early in your university days will definitely help to break this hierarchy. So, because hierarchy is not good for the patient outcome, definitely not good. So, we should work towards breaking this hierarchical pattern in healthcare so that we can give the best quality of care to the patient. So, thank you so much. I say right. Terima kasih banyak. Thank you.
Okay, thank you so much, Prof. Piru. Well, before I give my summary, so I invite you, students, if you can summarize what Prof. Piru has already shared, then I'll give you lemper. Do you want to summarize what Prof. Piru has already shared? Anybody? Ah, yeah, Mbak Cantik, come on. Mas Hendra, please help me. Okay. So I'll give you lemper and Mbak Pia then. Okay. Don't forget to mention your name, your study program, where you're
Sure.
from.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
First of all, I would like to say thank you very much for the opportunity. It is an honor for me to be able to ask to you, Professor. Thank you. My name is Chayasri Mega, and I'm from Studium nursing program. As the professor said, before that, building interprofessional collaboration for comprehensive management of metabolic syndrome are approached to be better patient outcomes, right? What challenges commonly arise when building interprofessional collaboration in clinical settings, and how can they be overcome? Then, what strategy can healthcare implement to strengthen interprofessional collaboration in managing consider lifestyle-related chronic diseases like metabolic syndrome? That's all the question from me. Thanks so much, Professor.
Okay, I think my lemper as Mbak Pia will stay here because I asked you to summarize, okay, what Prof. Piru has already shared. Okay, anybody wants to summarize? But thank you so much for the questions, Mbak Saskia. Later, Prof. Piru will answer the questions. Anybody wants to summarize? Anybody? I will add to Mbak Pia then. Oh, yeah, Mas Bro. Yeah, summarizing, okay?
Assalamualaikum warahmatullahi wabarakatuh. My name is Dandi. I have a question.
Question. Summarizing.
Summarize.
Okay. Summarize
Okay.
ki opo?
There are so many street foods around the world at Indonesia, India, UK, of course. At are do street foods give impact to our metabolic system? How far do street food impact to metabolic system? Sambun.
Okay, I'm really sorry, Prof. Yeah. So this is what happens in Indonesia. That's why Indonesian people do not travel a lot because we have this kind of boundary. So yeah. Okay, I'm going to help you to summarize what Prof. Piru has already shared. So the first thing that I can motivate you is because you are from multi-professional backgrounds. So Prof. Piru has already mentioned that you have to take pride to what you do. So you don't need to downgrade yourself. You don't need to feel ashamed. You don't need to think that, oh, I'm just a physiotherapist. I'm not a doctor. I am lower than doctor. No, but you have to be proud to be a physiotherapist, to be a nurse, to be a laboratory technologist, to be a nutritionist, because each profession has each rules and also each goodness. So you have to be proud of that. And then uh, this is the most important one, that you have ultimate responsibility to your patients. So the responsibility to the patient is not only the responsibility of a doctor, but you guys have the responsibility for the patients. You will feel proud of yourself if your patients can get better. So that's what later you have to do when you have already worked in the real world. Okay. And then I can say that multi-professional collaboration is multi-professions because it comes from multi-professions, but with one single goal. So the goal is to take care of your patients, to make your patients get better. And do you remember what Prof. Piru said about pickle? Do you know pickle? Ya. So tahu-tahu kalian ketawa tapi nggak tahu guyonan apa gitu ya. So Prof. Piru mentioned about his own. So she loves pickle so much and she got hypertension. Pickle is very high of salt, right? So his own said that it's better to die soon rather than eating without pickle in a single day. So the people goal right now is live happily. Although it's not live long, but it's live happily. Shorter is okay, but happy. Do you agree with that? Okay, so it depends on how you think about life, right? Okay, and actually, interprofessional collaboration has been applied in University of Leeds. It's not a single step, one by one profession, but there is a IPE, interprofessional collaboration. So they come together in one class, right, Prof? And then in the first year, they have similar values. So the university has to make sure that they have similar values and then respects and then roles. And then the second, in the middle year, they can have together case discussion, and then in the final year they can have case presentation and word rotation. Okay, please give a big applause for Professor Peter. Okay, now it's time for me to open discussion, not what is that? Summarizing. Okay, we have two questions from Mbak Saskia, yeah. Yeah. So the question is, what are the challenges for this interprofessional education, interprofessional, yeah.
Yeah.
So this multi professions. And then the second question is from Dandi. So from Dandi, he asked about how street food, because Indonesia, India, China, Korea, Thailand, we have great and delicious, tempting street foods that we can eat. So how do those foods influence people's metabolism and influence the metabolic diseases? And we have one more question from bro with glasses. Yes. Don't forget to mention your name.
Okay, thanks in advance for MC for giving me a chance.
Okay.
So good afternoon, Prof.
Yeah.
Okay, I am Abdurrahman Rafi from the Applied Bachelor of Nurse Anesthesiology program. On behalf of all students in here, I would like to express our appreciation and our gratitude for visiting and giving us incredible knowledge that I believe, okay, thank you, that I believe has enriched our academic understanding indeed. So my question is about our background in nurse anesthesiology, whose main role is in pre, intra, and post anesthesia. We often have a limited time and we must work quickly, especially during operation, compared to other health professionals like nursing and nutritionists who have a lot of time to maintain and exploring the medical solution and medical treatment for metabolic syndrome patient. So also in your slide about the key disciplines involved, there's no nurse anesthesiology mentioned on it.
No.
Okay, so my question is how far and how can we maximize our role in nurse anesthesiology so we have a better support and better involve overall and long-term management to metabolic syndrome management patients. Thank you, Prof.
Okay, thank you, Abdurrahman. So
Yeah.
that's the question. We have three
Okay.
questions. Prof. Piru, please.
Yeah. First one from you. There are no easy answers. We can list out all these barriers towards that. Personally, to me, the biggest issue is ego. You understand ego? Ego? EGO?
Ego.
What is in Bahasa Indonesia?
Oh, that's also ego.
Ego.
Yeah.
Of the professionals. Yeah, it's good to there is a faint line between confidence and pride and ego. Yeah. We all humans, we all can make mistakes. We are not superhumans. We can make mistakes. So when it comes to teamwork, it's not only in healthcare interprofessionals, in any kind of teamwork, the biggest barrier is ego of individuals. So if we can break that, take it to accept our mistakes and shortcomings, we can build a great team. Yeah. So I would say that is personal quality rather than just professional quality. We have to let go of our ego, but we have to be proud of our knowledge. We have to take pride in our abilities and skills. But we should always be humble and accept our mistakes. That will help. That will definitely help. Then all other things, like I said, like breaking this hierarchy by putting the students close by while learning. I have seen universities, I don't want to name the countries or universities, where the Medical classrooms are air conditioned, nursing classrooms are not air conditioned in the same university, in the same building. Yeah. So how will those doctors and nurses, they graduate from that environment, go and work together? You can't break the hierarchy by doing that. Yeah. So education, treating all professions equally, respectfully, will only help us to break this barrier. Yeah. Hope that somehow answers your question. It's not easy. The second one about street food. That's interesting. You can have salad as street food, can't you? You don't want to. Yeah.
Fried food is more tempting.
You can have tender coconut. It's a street food in Thailand. It's absolutely best for you. But in general, street food means something very quick, fried, unsalty, oily, high in calorie, low in vitamins and other nutrients, very low in fiber. Yeah. You probably heard hearing a lot about healthy eating. I'm sure dietitians know better the importance of gut health, fiber. Like people link each and every disease from heart failure to Alzheimer's to gut health. How important fiber is for your gut bacterium and how it is linked to recent like nature medicine papers and all like linking gut bacteria to Alzheimer's and stuff. So fast food, oily, fried, no fiber food is definitely not good. That is one of the reasons why the metabolic syndrome is increasing. But at the same time, your generation now you are just in the late teens and just getting used to it. But if you see the eating habit of 25 or 30 years old now compared to our generation, people are getting healthy. People are more conscious about what you are eating, what they are eating, and also thinking about. Even you raising this question shows that even during our medical program, we never thought about eating healthy. Yeah, when we were doing medicine, I was not thinking about eating healthy, eating cakes and stuff morning till evening. But you guys started thinking about it. That's a change. It will come. Again, we are following West bit later here. That uh, food revolution has come earlier in Western world, but there is 10% of the society who don't care. Though those are obese and stuff. But a lot of people give importance to food, what they eat, and how exercise. All these things are gaining momentum. But to answer your question, definitely street food is helping us to get more job and more money. So the final one, nursing anesthesia, anesthetic nursing. Yeah, it's a very, very interesting program. I spoke to your teachers this morning, like it's a unique program. Usually in UK and all, nursing anesthesia is in the specialty area. You do a basic nursing and then you train like a fellowship there. But you guys are fortunate to do this program at the undergraduate level. You must be very, very knowledgeable. That's good. Good for you. But I didn't even list surgeons, surgery, OT nursing into my list. So my hope is people don't end up in nurse, but in OT. But in OT, you guys are there to take care of. But the thing is, you have less time. I agree completely. That is anesthesia. Sir will agree very well. Anesthesia is such a high pressure profession. Like I admire my anesthesia colleagues so much. They have very short period of time and they don't even see patients a lot of time before the surgery. Maybe anesthetic assessment, few minutes, not a lot of time. But you guys are very high pressure situation. But still you can do the teamwork by doing the processing, planning, or reviewing and reflecting the practices. In UK, it's very common to do reflections. We don't we don't say here now write a note about this case. The question will be, what are your reflections from this case, whatever you have attended in the clinic? So the reflection is not just saying what you have done, but reflect on each point what you have done. Is it right? If it is right, can you do it better? If it is wrong, can you make it right? What would you do next time? How will you work better with the surgeon? How will you better work with anesthetist? How will you better work with the operation theater technician? There will be technicians there looking after heart lung machine, anesthetic machine, all those stuff. During the treatment, the oxygen might have oxygen technician or people who are looking after the gases, medical gases. You need to liaise with all those people. It is not like you have to do that only when you are doing cases. You have the opportunity pre-cases and post-cases. Doing reflections is the way you develop better practice so that next case you can work better with your colleagues, with your team in the operation theater. Yeah, that's how you can do. Obviously, you don't have the luxury of time going to the patient, talking to them like half an hour like dietitians or physiotherapists do. But you can do this by developing better teamwork, by doing a lot of reflections and planning as well. Thank you.
Okay. So I invite another question. Yeah, we have Pak Agung. Depan Mas Hendra. Maybe one or two more questions. Maybe guys, you can prepare your questions.
Okay, thank you very much, Professor Piru. I would like to ask you related to the interprofessional education. Of course, we have also learning about or mastery in cultural competence. It means that we have to respect also the cultural background, even belief and their religion. I would like to know how do you integrate the halal things in your education, because you know that as far as I know, England is one of the biggest Muslim community in Europe.
Yes.
Of course, there are many patients, many students also taking in England. So you know that in our belief that everything that come into our body should be halal.
Yeah.
So how do you integrate this education to the interprofessional education?
Thank you, sir. Thank you. Excellent question. I will start with an example. You guys have OSCE here? OSCE, like oral examination, stations, how do you, clinical examinations? OSCE, yeah. About 7 years before, I was an OSCE examiner for a third year medicine, like station by station. Yeah. We can't have, due to rules, we can't have a real patient there. You have to have simulated patient. So we pay some outside people, lay people, to come and act as a patient. Yeah. I was an examiner in a station. The acting patient was an Islamic lady with a hijab. Yeah. She was acting as a patient who was having some psychiatric illness. Yeah. Acting as mental health patient. There will be before the student enters that station, there will be a description of that patient. Then the student will read the description, then go inside the station and talk to the patient, and I will observe how they are talking, taking the history, what kind of treatment I will discuss with them, and then I will give the mark. Yeah.
The person who set up this examination put the outside instruction name of the patient, Alison Brad. Inside patient is an Islamic lady with a hijab. So the cultural insensitivity. It was 10 years ago. I raised that. We went through the exam. I raised that. A lot of people brought in different kind of things. Then it was consciously we have reviewed our texts, our slides, our mannequins. We have simulated mannequins where people learn putting IV line, doing CPR, those kind of things. We have found a company who does mannequins in different color skin tone with different kind of textures or body shapes. We have big Islamic community, black community, or South Asian community, Indian, Pakistani, Sri Lankan community, and obviously native white community also there. So we made sure our mannequins, our study materials, our example cases. For example, we never taught tuberculosis 15 years before in the curriculum. Now it is included because migrant population is there the TB has come back. So these kind of things are being incorporated. I won't say we have made it 100% like culturally sensitive and all religious beliefs are taken care of, but we are trying to do that. And also another thing is important that is practiced very well in UK is patient choices. The patient has the first choice of accepting or refusing any investigation, any treatment. Even for the simplest infection or some pneumonia, if there are 3 antibiotics which can be prescribed, patient will be given all the 3 antibiotics names and each antibiotics advantages, disadvantages, side effects, whatever it is. Then the patient can choose. Yes, it takes a lot of time. It is very resource heavy, but we had to do that to accommodate all beliefs, all notions, all individual perspectives. So things are changing, things are improving, but we are not yet there. Things are changing, and we are definitely aware of cultural practices and beliefs which will directly impact on the patient care. Thank you. That's a very good point. We all need to think because you never know. You may end up working in Canada or work in Sri Lanka. So you may need to learn about local culturals and practices. So you are not going to sit in front of computer and work. Computer engineers or structural engineers can work with inanimate objects. They don't need to worry about sensitivity. They don't need to worry about cultural sensitivity and feelings, but we are going to work with humans. So what we call our graduates are global ready or global citizens. We try to inculcate those things. One of my jobs is internationalize our education. That's why my title is given in global education. So I try to incorporate those things into our education. Each curriculum is reviewed with cultural connotations as well. Thank you.
Okay. Well, thank you so much. I think if you want to know more about what happens in University of Leeds and how does the university integrate IPE to the students, then you have to study hard. Maybe later you can take your master degree, your PhD degree. So we have a PhD degree from University of Leeds here. We have Bu Fitria from midwifery. So she is now studying in University of Leeds. So if you really want to know more about what happens in the global world and global education, then you have to study more, yeah, guys. Study more, and one more. Other than study more, then you have to learn English. If you don't learn English, then you will not understand what happens in the world, and you will never be studying there. Okay, so please give big applause for Prof. Peru for a great sharing section today. And once more, when guys, so after we close the meeting, don't go anywhere because we will take a photo session. Before the photo session, there will be a certificate given to Dean of Faculty of Health Sciences, certificate of speaker. Okay, yeah. There will be a certificate given to you. Thank you so much, Prof. Viro. Maybe we can. Yeah. Lihatin po. Okay, on behalf of all the committees today, so everybody, I hope that you get something to learn today. And I hope that it can motivate you to study harder and also to learn English more. So later on, you can take your master degree, your PhD degree abroad, or maybe even you want to work abroad, then it's going to be a better choice for you. Okay, let's close our meeting today by reciting Hamdalah together. Alhamdulillahirabbil alamin. Thank you so much for Prof. Piru, and then we will take a photo session together. Prof. Piru, maybe you can be here and stand up or gimana? Who is the photographer? Group selfie. You will be the photographer. Do the students need to stand up or sit down? Okay. Everybody please, you can stand up. You can berani iki loh, nang tengah iki loh, ngadeg nang tengah. You can come closer and then you can go to the middle. Don't be shy. Okay. Again. Don't be shy. Come on. To the middle please, to the middle. Nah, okay. Okay, Mbak Cantik, you are invisible. So if you want to be visible, then you can move there. Dah ya?
Satu, dua, tiga. Dua, tiga.
Freestyle guys, freestyle.